Good afternoon, all participants. We would like to present our research for the ISU conference. The title is Systematic Review of Health Economic Evaluation Study on New Herpes Zoster Vaccine for Elderly. Next. This is the background and rationale of our research. Chickenpox is an infection caused by the varicella zoster virus. It causes an itchy rash with more. Food it feel blister, spit or stare in a small area. About more than 95% of persons who reach the age of 15 years old have already been infected. Patient symptom is fever, then having red spots which can appear everywhere on the body and might. The spots fill with fluid and become blister. Then blisters are exposed and produce the scars. Normally, chickenpox general course within a week or two without treatment, but the patient may have complications called post-neuralgia or nerve pain when getting old. Letter B. People with immunocompromised conditions such as HIV have the highest risk of the last complication by zoster virus and need the supportive treatment together with acyclovir drug. Next. Nowadays, we have the vaccine to prevent both early and late neuralgia or shingles. Previous evidence showed that new herpes zoster vaccine type can reduce the risk of shingles among elderly about 96%. However, new vaccines are generally much more expensive than standard treatment. Therefore, cost-effectiveness evidence is necessary for consider the incorporation or implementation of such vaccine into a national public health system. This review study aims to collect and summarize of economic value evidence of the new zoster vaccine through economic evaluation study published worldwide for begin as supporting evidence to health policy maker decision making regarding the new vaccine agent shingles. Next. The objectives are to systematically review literature on economic evaluation study of new herpes zoster vaccine and to collect and analyze all economic evaluation published worldwide in order to assess a vaccine economic value and its context, and to assist the health policy judgment regarding shingles prevent vaccine. Next, the expect research benefits are gaining the knowledge on economic value of shingles preventive vaccine. Review results will be disseminated to health policy makers for assessing their decision on this vaccine under their own health system and the reader or audience who wish to use this vaccine. Next slide, Chaniporn will talk about method.
Our method consists of defining keywords for searching info electronic database. Keywords are varicella, vaccine, economic evaluations, and pharmacoeconomics. Database used are Medline, Scopus, Google Scholar, and Google Search Engine. Research inclusion and exclusion criteria. For example, 2 economic evaluation studies of herpes zoster vaccine are included, and previous review studies are not. Quality assessment of eligible study using standard SHARE checklist. And next, this diagram shows our search results. We found 771 records, then 620 records were excluded after title or abstract screening, so we had 151 records left. Then, among 151 records, 63 records were duplicated, so that we had 88 records for second round screening. 6 studies were non-English and Thai language. 26 studies were all zoster live vaccine due to it has no efficacy to prevent shingles compared to placebo. and 47 studied childhood varicella vaccine were then excluded. Finally, 9 food tech studies were included in this research. Next, this table shows the characteristics of all included studies. Recombinant zoster vaccine has been sold since October 2017, so the study that's published before October 2017 will not be used to analyze a cost-effectiveness property. All of them are conducted in high-income countries and use model-based Markov economic evaluations. This means they use calculation program instead of correcting cost and health outcome alongside clinical trial. In funding, 3 studies are for profit from USA and Germany, 4 for non-profit, and the last 2 for no external funding. Next, Napasawan will present about the conclusion.
This table shows the cost-effectiveness conclusion of all included studies. From 9 studies are the studies that compare to a different vaccine. 6 studies use all herpes zoster vaccine and no vaccination scenario as a comparator to recombinant zoster vaccine. 2 studies use no vaccination scenario, and the last one used all vaccine as a comparator. The incidence of herpes zoster used in the included studies are quite high, about 500 to 1,500 single episodes per 100,000 populations per year. Price of the vaccine is about $140 per dose or 4,500 baht. In this slide, you can see the most of the study used almost 100% vaccine efficacy to prevent shingle flare or recurrence. In conclusion, all included studies adopt cost-utility analysis, which 5 studies indicate that recombinant zoster virus is cost-effective. 3 studies conclude recombinant zoster virus is not cost-effective, and another one study conducted to find out the highest price that the vaccine is still be cost-effective. From this graph, we plot each answer from X study against the cost-effectiveness threshold of $50,000 per colligain after adjusting all currency into US dollar in the same year. Spot below the threshold red line means vaccine is cost-effective. We found that 5 studies indicate that new vaccine is cost-effective, whereas 3 studies are not. This slide shows the discussion and conclusion. Evidence suggests that new shingles preventive vaccine is cost-effective. 6 out of 9 studies. All studies are conducted in high-income countries and omit herd immunity effect. Most sensitive input parameters were efficacy waning of vaccine, vaccine price, and incidence of shingles. High incidence among high-income countries made vaccine tends to be cost-effective. Incidence evidence from Thailand is 20 times lower than those high-income countries. Others expect that low and middle-income countries might have low incidence. Therefore, vaccines tend to be cost-ineffective. At the current price, $140 or 4,500 baht per dose. This suggests that this vaccine needs to reduce its price substantially in order to be a cost-effective intervention under developing countries. Our research has some limitations. First point is researchers included only papers published in English and Thai language. Second point is a lot of studies on all vaccine types for shingles prevention were excluded. And last point is no study conduct from developing countries. Therefore, careful consideration should be made before using these research results for applying under the context of poor areas. Thank you for your attention.
Okay, thank you, Ms. Chaniporn and your colleague. And are there any questions from the participants? Okay, may I ask for one question? My question is, patients who get herpes zoster, do they still need vaccination or will they get immune in their body?
Can you hear my voice?
Yes, ready.
If the patient is very old or immunocompromised patient, they still need to vaccinate this type of vaccine.
Mm-hmm. Okay, and the second question is, from the result, it was found that in some developed country, the result were opposed among other countries. Are there any factors that contribute to this result?
Sorry, I can't hear clearly because I have concurrent teleconference. Can you type it for me?
Okay, just a minute, อาจารย์สุรชัย Okay, my question is, from the result, it was found that in some developed country, the results were opposed among other countries. Are there any factors that contribute to this result? Ajahn Surachai, could you see my message? Okay, Ajahn Surachai, he answered my question. The answer is yes, the incidence of herpes zoster among elderly in developed countries is also the most important factor. Are there any questions from the participants? More questions? Okay. If any more question, we will go into the next presenter. Thank you อาจารย์สุรชัยครับ The next presenter